Welcome to a comprehensive guide on understanding congestive heart failure and its management strategies. Let's kick things off with the basics. Congestive heart failure is a condition where the heart's pumping power is weaker than normal. This means that the heart, which is responsible for pumping oxygen and nutrient-filled blood to the cells of the body, isn't able to do its job efficiently. The heart's chambers may respond by stretching to hold more blood to pump through the body, or by becoming stiff and thickened. This helps to keep the blood flowing, but the heart muscle walls may eventually weaken and become unable to pump as efficiently. As a result, the kidneys may respond by causing the body to retain fluid and salt. The body's cells then don't get the oxygen and nutrients they need to function properly, leading to the symptoms we'll discuss in the next part of this guide. With that understanding of what congestive heart failure is, let's delve into the symptoms. Now let's talk about the symptoms of congestive heart failure. Congestive heart failure is a condition that can manifest itself in several ways, and its symptoms can significantly impact daily life. The first of these symptoms is fatigue. It's not just your typical tiredness after a long day. This is a profound, persistent exhaustion that doesn't go away with rest. This happens because your heart can't pump enough blood to meet the energy needs of your body, leaving you feeling worn out most of the time. The next symptom is breathlessness. This is not just feeling out of breath after climbing a flight of stairs. This is a constant shortness of breath, even when you're at rest or lying down. In some cases, it might wake you up from sleep. This happens because your heart can't keep up with the body's demand for oxygen, causing fluid to back up into the lungs. Then there's the symptom of having an accelerated heartbeat. This can feel like your heart is racing or throbbing. It's your heart's way of trying to compensate for its inability to pump blood efficiently. It speeds up in an attempt to deliver more blood to your body. Lastly, swelling is another common symptom. This usually occurs in the legs, ankles, and feet, but in some cases it can also be seen in the abdomen. This swelling, known as edema, is the result of fluid buildup in your body, another consequence of your heart not being able to pump blood effectively. Each of these symptoms can make daily activities challenging. Simple tasks like walking the dog or even just getting out of bed can become difficult. It's important to remember that these symptoms can vary from person to person and can range from mild to severe. Knowing these symptoms is crucial for timely diagnosis and treatment, which brings us to the next topic. Diagnosing congestive heart failure involves a series of tests. This is not a one-and-done deal. Instead, it's a comprehensive process that uses multiple tools to get to the heart of the matter, quite literally. First up, we have the electrocardiogram, often shortened to ECG or EKG. This test records the electrical activity of your heart through small electrode patches attached to the skin of your chest, arms, and legs. It's fascinating, really. This test can detect heart rhythm problems and damage to the heart muscle. Next in line are blood tests. These are used to evaluate the levels of certain substances in your blood that might indicate heart failure. Blood tests can also highlight other conditions that could be causing or contributing to your heart problems, such as anemia or infections. Then we have the chest X-ray. This test helps doctors visualize the heart and lungs. It can reveal signs of heart failure, such as an enlarged heart or fluid in the lungs. Following the chest X-ray, we have the echocardiogram. This test uses sound waves to create a moving picture of the heart. It provides detailed information about the size and shape of the heart and how well the heart chambers and valves are functioning. The stress test comes next. During a stress test, you'll walk on a treadmill or pedal a stationary bike while your heart rhythm, blood pressure, and breathing are monitored. This test helps to determine how well your heart handles work. Finally, there's cardiac catheterization. In this test, a thin tube or catheter is inserted into a vein or artery and threaded through your blood vessels to your heart. This allows the doctor to examine the arteries supplying your heart and check for areas of blockage. Once a diagnosis is confirmed, it's all about managing the condition effectively. But remember, knowledge is power. The more you understand about these tests, the better equipped you are to navigate your journey towards heart health. Managing congestive heart failure involves self-care measures. Let's delve into some of these self-care strategies that can help in managing this condition. First off, adhering to prescribed medications is of utmost importance. Medications play a crucial role in managing heart failure, so ensure to take them exactly as directed by your healthcare provider. Missing doses or taking more than prescribed can have serious consequences. Next, you should monitor your symptoms regularly. Keep a close watch for any changes in your body, such as increased fatigue, breathlessness, or swelling. These might be indicators that your condition is worsening, and you should seek immediate medical attention. Another significant measure is limiting your salt intake. Excess salt can cause your body to retain water, worsening the symptoms of heart failure. Try to keep your daily sodium intake under 2,000 milligrams, which is roughly equivalent to 1 teaspoon of salt. Maintaining a healthy weight is equally important. Excess weight can put additional strain on your heart, so aim for a healthy weight range. Consult with your healthcare provider or a nutritionist to find a diet and exercise routine that works best for you. Avoiding smoking and alcohol is also crucial. Both of these can damage your heart and further exacerbate your condition. If you need help quitting, don't hesitate to reach out to your healthcare provider for support. Staying physically active can help strengthen your heart and improve your overall health. Simple activities like walking or gardening can be beneficial. However, always consult with your healthcare provider before starting any new exercise routine. Lastly, be cautious with new medications or supplements. Some over-the-counter medications and supplements can interact with your heart failure medications or worsen your condition. Always check with your healthcare provider before starting any new medication or supplement. Beyond self-management, there are medical treatments available to help manage this condition. Treatment options for congestive heart failure include medications, medical devices, and surgical procedures. Let's delve a little deeper into each of these. Medications play a crucial role in managing heart failure. Depending on the specifics of one's condition, doctors may prescribe a combination of drugs, each with a unique purpose. Some medicines help to strengthen the heart's pumping action, while others may assist in controlling one's blood pressure or reducing fluid buildup. Importantly, these drugs aim to alleviate symptoms and improve quality of life. Moving on to medical devices, these are designed to support the heart and improve its functioning. For instance, pacemakers can help regulate heartbeats, while implantable cardioverter defibrillators, or ICDs, can correct potentially life-threatening irregular heart rhythms. In more severe cases, ventricular assist devices, also known as heart pumps, may be used to help the heart pump blood more effectively. Lastly, surgical procedures may be considered for individuals with advanced heart failure. This can range from coronary bypass surgery, which improves blood flow to the heart, to heart valve surgery, which corrects any issues with the heart's valves. In the most severe cases, a heart transplant may be the best course of action. It's important to remember that each person's treatment plan will be individualized based on their specific condition, overall health, and lifestyle. Having open, ongoing conversations with your healthcare provider is crucial to managing heart failure effectively. While treatments can help manage the condition, prevention and early detection are key. In conclusion, understanding congestive heart failure is crucial for effective management and treatment. It's a medical condition where the heart's ability to pump blood effectively is compromised, leading to symptoms such as fatigue, breathlessness, accelerated heartbeat, and swelling. Diagnosing this condition involves a range of tests, from an electrocardiogram to a cardiac catheterization. But remember, managing heart failure isn't just about identifying it and seeking medical help. It's also about taking care of yourself. Adhere to prescribed medications, monitor your symptoms, limit your salt intake, maintain a healthy weight, and avoid smoking and alcohol. Stay physically active and be cautious with new medications or supplements. As for treatment, there are several options available. These include medications, medical devices, and surgical procedures. The choice of treatment will depend on your specific situation and the advice of your healthcare professional. So don't hesitate to seek help and advice. Remember, your heart health is in your hands. Stay informed, stay healthy.